Welcome to today's Town Hall discussion on UB's health and safety guidelines. I'm Scott Weber, Provost and Executive Vice President for Academic Affairs at UB. As we prepare for the start of the fall 2020 semester, our number one priority has been and continues to be protecting the health and safety of the university community. At UB, we are very fortunate to have among our faculty colleagues infectious disease and public health experts, as well as professionals in environment, health and safety, student health services, and human resources. We have brought together a group of UB faculty and staff to respond to your questions regarding the measures we are putting in place to protect the faculty, staff, and students on campus and reduce our risk. Before we get started, I am so pleased to introduce UB President Satish Tripathi, who would like to say a few words.
Thank you, Scott, and good afternoon to all of you joining us today. I'm pleased to welcome you to our town hall on UB's health and safety guidelines for the fall semester. Before we engage in this important conversation, I would like to acknowledge all of the members of our university community who have been so deeply involved in our comprehensive planning process. I would also like to thank our university leaders who have helped guide this process over the past several months, including Provost Weber and Vice President and Dean Michael Kane. As I said, this was a truly comprehensive process. Comprehensive in that our planning has involved faculty, students, staff, and administrators from across campus and disciplines. And comprehensive in that we have intentionally prepared for the challenges that lie ahead in every domain, including public health, university finances, enrollment, academic continuity, research, and overall student experience. Throughout our planning process, the health and safety of our entire university community has always been our first priority. At UB, we are fortunate to have some of the nation's most renowned experts in the area of infectious disease and public health. Over the past 5 months, they have been frequently sought out for their advice and knowledge about COVID-19. Some have been researching therapeutics and cures, and many have been on the front line of patient care. These same UB faculty have also been directly involved in our health and safety guidelines for the fall 2020 semester. I truly appreciate the expert input of our faculty, just as I appreciate the resilience, resourcefulness, and innovation of our entire UB community has demonstrated over the last 5 months. At this point, I would like to turn the conversation back to Provost Weber. Scott?
Thank you, President Tripathi. Dr. Michael Kane, who serves, as President Tripathi said, as the Vice President for Health Sciences and Dean of the Jacobs School of Medicine and Biomedical Sciences, chaired the committee composed of campus medical, infectious disease, laboratory medicine, and public health experts that developed UB's health and safety guidelines. They have been actively working on these guidelines for nearly 3 months. These guidelines are based on evidence-based methods recommended by the most recent scientific research and CDC, SUNY, and New York State guidance for our higher education institutions, as well as their own expertise. We are very grateful to Dr. Kane and all the members of the committee for the time and effort they have spent to ensure a safe return of our faculty, staff, students, and visitors to the campus. I am now pleased to introduce Dr. Michael Kane to provide a more detailed overview of the guidelines.
Thank you, Scott, and good afternoon to everyone. As both the provost and the president mentioned, I was lucky and honored to chair a committee of very, very gifted people that both have articulated background expertise. And we also, in addition to the outside areas and people of expertise that we were able to take advantage of, in my role as Dean of the Medical School, was also able to take advantage of weekly meetings of all medical school deans through the Association of American Medical Colleges, in which guidelines for reopening university campuses were frequently discussed. And I'm also fortunate enough to be a member of the Western New York Reopening Control Room with Lieutenant Governor Kathy Hochul, where directly and indirectly with the governor's office am exposed to data related to the COVID infection in both Western New York and the state of New York, and direct access to the governor's office. So our guidelines, which along with a UB-wide health awareness campaign, emphasize personal responsibility and importantly include a pledge that I want each of us to take. And it really does emphasize that for this to work, whether we were in Buffalo or any place else in the country, part of our public health depends on personal responsibility. And I pledge to take care of myself, and I also pledge to take care of all of you by wearing protective masks and practicing physical distancing and meticulous hand hygiene. And in return, I ask that each of you protect yourselves and also protect me by doing the same. Our guidelines begin with a voluntary precautionary quarantine for 7 days. And this is applicable to people who have been away from the campus during the summer and are now returning to the campus in August, and also for anyone who's coming to our campuses for the first time. And the purpose of this 7-day quarantine is to allow time for those who may have the virus to express themselves symptom-wise before we actually get back to restarting classes. And importantly, give each of us 7 days to think about the environment that we're going into, to remember that pledge, to adjust to a health culture that is new for us, and ask people to be aware of their temperature, again, get used to wearing masks, and coming to campus prepared for an environment that will be safe as long as we uphold this personal responsibility. The campus will follow the New York State mandated 14-day quarantine for people coming from states or from countries with high infection rates. The guidelines as a keystone require face masks at all times when on campus, and also strongly encouraged for when you're off campus, but on campus, whether you're indoors or outdoors. The physical or social distancing to remain at least 6 feet from each other wherever one is. And again, to stress personal hygiene. And also the common sense fact that if you wake up in the morning and simply don't feel well, don't come to the campus, stay home. The guidelines have daily screening that will use a chatbot technology that will allow each of us to declare whether we have any symptoms or physical findings of COVID-19, or whether we've had any contact with someone who may have had or definitely had the infection. This chatbot also provides educational materials about the disease, a large number of frequently asked questions with answers provided by experts in the field. And this chatbot technology is for all of us, whether we plan to come to campus all the time, some of the time, or whether we'll be spending the fall semester at home. And this also is applicable to us whether we are in Buffalo or whether we have left the city for travel. You'll be able to use this technology wherever you are, because we do care about all of us and want to protect all of our health. Direct viral PCR testing will be used for individuals who have symptoms. There will be appropriate quarantine while we're waiting results and isolation of individuals if the test turns out positive. And the university will be informed of everyone who is in the UB community who unfortunately ends up having a positive test. We have included the Erie County Department of Health and Gail Burstein as part of our working committee, and we will work as partners and support the Erie County Department of Health contact tracing program. And we are actively looking at adjunct, either smartphone or other modalities that will help us gather more robust and accurate information about people who will have been in close contact with someone who does in fact have a positive COVID test, and help the Department of Health do the direct contact tracing program that they have. The general guidelines for some schools will have a supplement of guidelines specifically applicable to the school for those who are involved in special clinical areas and clinical educational programs, as well as for individuals who represent individuals in vulnerable populations or our student athletics. Other important components of the overall health guidelines at a campus level involve university and campus operations that will adhere to all hygiene, cleaning, and disinfecting requirements mandated and recommended by the CDC as well as the New York State Department of Health. UB is also utilizing a mixture of traditional in-person seated classes as well as remote learning to purposely reduce in-person density and congregation. In addition, each of us who oversee administrative units and research labs have already submitted and have received approval through the university to maintain the workforce in our administrative units and laboratories at a density of 50% of what we were doing prior to the COVID pandemic, in an effort just to decrease at any moment in time the number of people who are on any of our 3 campuses. Developed and will continue to develop extensive communication plans for the campus community that will be released to the community throughout the fall semester. And finally, want to emphasize that as our working group has been working on this for 3 months and will continue to do so throughout the pandemic, these guidelines will be updated regularly. Thank you.
Thank you, Michael, for your overview. And now let us begin the question and answer period of the town hall. Our moderator for today's question and answer session will be John Delicatrata, UB's Vice President for University Communications. John?
Thank you, Scott. I'm pleased to be serving as moderator for today's town hall. Greetings to the many members of the UB community who are joining us this afternoon. We hope today's event answers your questions and eases some of your concerns. So let's start by introducing our 9 panelists, several of whom served on the committee that developed the health guidelines chaired by Dean Michael Kane. So in alphabetical order, our panelists are Mark Allnut, Director of Athletics, Dean Kane, who we've already mentioned, who chaired the committee, Mark Coldren, Associate Vice President for Human Resources, Graham Hamill, Vice Provost for Academic Affairs and Dean of the Graduate School, Joe Rabb, Director of UB's Office of Environment, Health and Safety, Dr. Thomas Russo, Chief of the Division of Infectious Diseases in the Department of Medicine within the Jacobs School, Susan Snyder, Director of Health Services here on the campus, Jean Watkowski-Wendy, Dean and SUNY Distinguished Professor in the School of Public Health and Health Professions, and of course, Provost Scott Weber. So our panelists are here this afternoon to answer your questions about our health guidelines, and members of our audience can send their questions using the Q&A function at the bottom of their screen, or you could email your questions to ub-town-hall@buffalo.edu. That's ub-town-hall@buffalo.edu. So we've received a number of questions via email prior to today. And we have a few of those to start. And then we have my assistant, David Hill, is gathering the questions that are coming in through the Q&A function. So please start sending those in. The first question has to do with UB's face covering requirement, which, as Michael Kane stated, states that face coverings must be worn everywhere on campus, indoors or outdoors, unless students are in their private dorm rooms or employees are in an enclosed private office. So Dr. Russo, you've been a very strong proponent of the importance of wearing a face covering as much as possible to help prevent the spread of COVID-19. And you and other members of Dr. Kane's committee made sure that it was a requirement, a strict requirement of UB's health guidelines. So why is wearing a mask so important to fighting the virus?
Masks or face coverings are really the most important measure that we could do to prevent infections with the new coronavirus. Hopefully everyone that's viewing this webinar appreciates that respiratory spread is the primary mode of getting infected. So mask usage obviously is logical. Plus, a large body of data has now been accumulated that supports that masks significantly decrease spread of this virus. And as Dean Kane mentioned, mask usage not only protects you if you're not infected, but if you are infected and don't realize it, it protects others. So it's a critically important measure and really our best chance to keep this virus under control. So as mentioned, the plan mandates universal mask usage in all settings. There's just 3 exceptions. If you're alone in a closed space, such as your office or in a study room, then a mask is not necessary. Or likewise, if you're alone in your car. And lastly, if you're alone in your dorm room or with a roommate, then a mask is not required. I just want to mention that some people are a little concerned about mask usage, that it might prevent them getting from enough oxygen or a buildup of carbon dioxide. These are urban legends. They are just not true. Mask usage is safe for you, and it's very important for us to keep the new coronavirus under control. And it's also important for you to realize that all masks are not equal. So in our guidelines, we advise that the best masks to use are surgical masks or multi-layered cloth masks with a high thread count. Please, please don't use bandanas or scarves or loosely knit masks. If you could see through them, or another test that's become popular, particularly in social media, if you blow through the mask and could, make a candle flame waver or feel your breath through the mask, it's a poor quality mask. And likewise, something that's really less appreciated, that masks with valves, even though you might be able to breathe easier, are not safe for others. These are one-way valves that will protect you, but if you're infected, you'll just expel infectious particles. So please, no valved masks on campus. And lastly, please wear your mask correctly. I'm sure all of you have been to Wegmans or have gone out and see the mask users with the below the nose look or the dangling mask around the neck. Obviously, that's not helping anyone at all. So I can't advocate mask use more strongly, and it is our #1 ticket for keeping everyone safe and keeping our campus open.
Thank you, Dr. Russo. Probably the most frequent question we received leading up to the town hall, and some of the questions that are coming right now, has to do with the issue of compliance. How are we going to make sure and ensure people follow the guidelines, wearing a mask, social distancing, etc.? So it's a follow-up question, Sue Snyder. What is being done to reach students, and what will be done to make sure they comply with the mask requirement and the social distancing requirement?
Thanks, John. The real aspect here is that every person in the UB community needs to play their part. And so by caring for others, we really need to be doing those public health measures. So in terms of enforcement, it's really about the initial step is having a polite and respectful conversation with someone who's not following the rules. So if that's a possibility, we encourage all members of the community to take part in that initiative and engage people. Do they know the policy? Did they simply forget to bring their mask to campus? Do they know where they can get an additional mask? In terms of students in particular, I think one thing that the community doesn't yet really know and has not yet been published widely is there is a compliance policy that will be in place for students. And we will be publishing that and communicating that widely to students as well as faculty and staff. They can be asked to comply by any university official, which really means any university faculty or staff member has the expectation or should have the expectation of helping to enforce and educate compliance. They can also be referred to an online class experience where health promotion will be teaching a course, Healthy Campus public health class. And so that could be referred and mandated. Clearly, if there is a refusal to comply, that will be escalated and can lead to disciplinary action and potentially expulsion if necessary and extreme.
Great. Thank you, Sue. Sounds like a well thought out plan. Mark Cauldron, on the employee side, what's in place to help with compliance among employees?
Thanks, John. We would reiterate a lot of what Sue just shared with everyone. This is about a community that is understanding what it means to be compliant, that it is a community that we care about each other. And so it is that permission to go up and remind each other. And one of the ways that we're going to do that is we've created a program that we're going to call advocates. Advocates are going to be people that we're going to work with in a workshop to help them with ways to approach people in a positive manner, to help remind them, to let them know about their personal responsibility in the community. They may also have a few spare masks in case anybody forgets one. And the whole idea is to remind and to do it in a positive manner. It's our understanding campus living and student life is going to also create advocates in a similar format so that we'll have people around to remind. The other way I'll suggest is that as people are accountable for their own behavior as employees, we have to follow an element of what's expected of us. And then when we don't do the things that are expected of us, there is a progression up to and including, a disciplinary procedure that could happen. It's our belief people will understand the importance of being a good member of the community, but we will hold people personally accountable for their actions. And it's important for everyone to understand that they really should help by talking with supervisors so that supervisors can provide direction. And clearly the Office of Human Resources, me directly, people have done this so far and reached out and said, hey, Mark, I've seen some folks that don't have masks and they tell me where and when. And I've been able to reach out to folks in labs and areas, and they've all been very, very understanding and have reminded their folks. So we hope that personal accountability, just as Sue described, is the way we see employees participating in our community.
Well, Mark, we're seeing a couple of questions come in. People want to be able to know what to say when they need to approach somebody not wearing a mask. Will there be some guidance coming from HR or from student life, Sue, helping people with some, some talking points or some polite ways to approach people who might not be wearing a mask?
Yeah, John, in fact, actually a lot of the stuff that's in the advocate program, we're going to put right out on the website as part of an FAQ for people, particular phrases you could use to go up and see someone and do it in a positive and polite manner. So they will be available for people to go see those, as well as we hope that people have this permission to kind of remind each other. And it's not a confrontation. It's just an opportunity to remind that it's important to be part of the community.
Great, thank you.
Yeah, and if I could just jump in here, I think a great starting point is to ask the individual first, well, why are you not wearing a mask? It may be as simple as because they forgot it or they don't have the resources to get one. So that's a good start. And if they do have a mask and choose for, and there's a variety of reasons not to wear that, I think it's important to remind them, I understand that, but everyone else is pretty much doing it. And this is really not about so much you as an individual, but us as the UB community and us as the, the Western New York community at large, right? We're integrated with the community. What happens on our campus is going to impact the community and vice versa. And I think if they understand that, that's often a very effective way for them to sort of buy in to the mask culture, which is going to be so critical for us.
And I think one other thing is just to go back to the pledge. And, if we each take that pledge, then it becomes, a reason to bring up as to why we are wearing masks and the pledge we make to each other.
Yeah, we're getting some questions from faculty wondering how they could approach students in the classroom who might not be wearing a mask. I wonder if any of our panelists, Graham perhaps, or Provost Weber, did given much thought to this.
I can say a couple of words. So I would also just reiterate what Sue said, is that there is a policy for students who are habitual non-mask wearers. The first step obviously is to approach students and remind them that they're supposed to wear a mask. But if there's a habitual problem, then students can be referred to or mandated to take an online course for education, or there is also disciplinary action that can be taken that's really based on the classroom disruption policy. But really, for the classroom in particular, the most important first step is on the first day of class. We strongly recommend that faculty include a link to the website that Sue mentioned that gives the policy about mask wearing. And it's also really important to have a discussion with students the first day to set expectations about mask wearing, not only that students should wear a mask, but also sort of following up on some of the points that Tom and Michael made about the kind of mask that students should wear, what to do. Is drinking acceptable? Can students actually take their mask off for a second if they're having coffee? Is that acceptable in the classroom or not? Reminding students that they shouldn't come to class with meals that they're going to eat with their mask off. So having that discussion from the very beginning and setting expectations from the very beginning for everyone, I think, is a very good way to start the semester. And it really enables faculty to take more direct steps if needed throughout the semester.
Great. And related to that, Graham, faculty will be wearing masks in the classroom. Will face shields be available for faculty if requested?
Yes, and maybe Joe could say a little bit more about that. I would just say that that masks are clearly preferred, and classrooms are also being enhanced with technology so that there'll be microphones, so that there shouldn't be projection issues for faculty who are lecturing with masks. But there might be specific circumstances when faculty feel like a face shield is more appropriate. Maybe Joe could talk a little bit about what that process would be.
Yeah, so as mentioned, the preferable way to conduct a lecture would be to wear a face covering, but we recognize that not all people will be able to successfully lecture with a face covering on. And several people have brought to our attention that there may be some people in the audience, especially the remote audience, who have difficulty understanding them if they're wearing a face mask. And so some of our lecturers have indicated that they would prefer a face shield. Now, a face shield has some protective value, but the CDC indicates that it's not quite as good and not quite as preferred as a face covering. And so we will be allowing face shields in some lecturing circumstances, but we also want them to be used with a strict discipline of maintaining a social distance of at least 6 feet and maybe more than 6 feet if the lecturer is using a face shield. The face shields will be available through a process through EH&S. The lecturers who want those will be required to submit a work order. EH&S will meet with them, or not meet with them, but we'll call them or somehow get together with them and indicate what their use is for. And then if we agree that it's a needed requirement, then we will have a sign-off form where they have to just indicate that they'll use the face shield in the proper way and that they understand that there may be a little bit more risk of using a face shield versus a face mask. Once they've signed that, they'll be able to pick up a face shield from our facilities warehouse on North Campus. So we will detail that process in full and get that out to everyone.
Great, thank you, Joe. We just one other follow-up question before we move on from face coverings. Dr. Russo, we're seeing some questions come in. People are, concerned that, it's not always feasible to maintain 6 feet of distance, and they're wondering about that and how they can still stay safe even though they might have encounters closer up with people.
Sure. So that's why the face coverings and masks are so important. When you're in circumstances when you're going to be closer than 6 feet, the mask should be protective as long as both people are wearing the correct type of masks or face coverings and wearing them properly. So obviously we want to minimize encounters in close quarters. And if you have to be in close quarters, you also want to minimize the time that you're doing that. But masks should provide an adequate layer of protection in that setting.
Great. All right, thank you. Let's move on to the question of testing. We received a lot of testing questions in our Q&A function here, and some questions on testing through email as well. So the main gist of the question is, wondering about UB's testing protocol. Many universities are testing students before they come to campus, or testing students every day, or doing some baseline testing in some fashion. What is UB's guideline for mass testing, and how is it being, or not, and how is that being implemented? Dr. Russo?
So one of the major goals of our plan, obviously, is to minimize the number of infected individuals that are going to be on campus. And the plan has a number of measures in place to affect that. The first, as already mentioned by Dean Kane, is the New York State mandated 14-day mandatory quarantine from individuals that are coming from hotspots, other states or any other country in the world. We have only less than about 200 students that would fall in that category. That's measure number one. Dean Kane also mentioned the 7-day voluntary quarantine as well, which will be very helpful in minimizing infected people arriving on campus. And then lastly, a very important measure is the chatbot screen for symptoms and close contacts, which we're asking everyone to do every single day, so that if you do develop symptoms or a close contact, you'll be appropriately directed to get tested, quarantined, and isolated as appropriate. But what was discussed and really in significant detail was whether we should have a one-time mass testing upon everyone returning to campus. And at the end of the day, we decided against this for a variety of reasons that I just want to delineate for you so you understand our thought process behind this. So I think the first is, let's just do a little math. And we're really blessed here in Western New York. We're one of the few regions that has a very low incidence of community disease. So presently, and hopefully this will continue if everyone's good behavior continues, we have 3.6 cases per 100,000 individuals in our region. So we have approximately 40,000 students, staff, and faculty at UB. So if we did a one-time spot testing, this would translate into 1.5 cases that we would actually detect. Now let's double that, because we know that there's about 30 to 40% of individuals that are asymptomatic. But even if we doubled it, we're still talking in about a relatively few number of cases that would be detected. It would really only be a guesstimate in about 3 cases. So you could say, okay, well, 3 cases, we've still identified those individuals. That has a certain amount of value. But another pragmatic reality, unfortunately, is when you do mass testing like this, Unfortunately, at least at this time, we are not going to get the results back within hours or certainly less than a day. Right now, on average, in this country, it's closer to 5 and 10 days, and in some instances, even greater than that. So even if we identify these individuals that are potentially infectious, from a pragmatic point of view, as time increases before the turnaround of that result, the infectious period of that individual will decrease, and so that by the time we're notified, they'll be minimally or not infectious at all, and they would have interacted with other individuals, and so decreasing really the value. Now, the way to get around to that is, of course, when we did the one-time testing, if all 40,000 individuals quarantined, that would work, but obviously that's not particularly pragmatic. However, I get it that you say, okay, 3, 5, whatever individuals, but what if that person is in my office, in my lab, in my classroom? You know, that's putting me at risk. I'm uncomfortable with that. I'm perhaps not feeling safe. And this is where the role of masks is so vitally important. We know masks could protect you in this situation. If you're wearing a mask and that small number of individuals that could have been identified by mask screen are also wearing a mask, the likelihood of someone getting infected is exceedingly low. The number is never zero in medicine, but very close to that. An example I'd like to use, and some of you may have heard me state this example before, is a real life example in Missouri. There were 2 hairstylists, both of whom were infected. And by the time they were tested and identified, they had interacted with 139 clients. Fortunately, everyone was wearing masks in that setting, and no one, let me repeat, no one was identified to be infected. So I think that really is reassuring that our sort of our critical centerpiece of public health measures and mask usage will protect us even when there's a few members on campus, which is inevitable, will be infected with the new coronavirus. And, you know, I can't emphasize enough the reason it's so important to embrace these public health measures, because even if we did that mass testing on day 1, of the, nearly, 39,997 individuals that tested negative on that day, well, on the next day, a few of those might be positive. On the day after that, some of those individuals may be positive. So a one-time testing is really of limited value, but if we embrace those public health measures, we'll be able to go ahead and protect ourselves. A couple of other reasons that we decided against this. Obviously, there's considerable resources that would come to bear in terms of mass testing such as this that could potentially be used better elsewhere. And finally, the CDC, New York State, and SUNY at this time are not advocating or recommended mass testing. So taking together, we decided, at least at this moment, not to employ a mass testing program.
Okay, so we're not doing mass testing, but what is UB's approach to monitoring the health of the campus and then testing those who might be symptomatic? Sue, do you want to take that on from the student point of view?
Sure. What I would say is Dr. Kane had mentioned a little bit earlier that we will be rolling out a screening tool that will allow students, faculty, staff, and others, maybe contractors or vendors coming to campus, to do a screening. It's very similar to the screening that is now in place through our Human Resources Department in terms of the questions. So it will ask about symptoms. It will ask about contact with a known or suspected case. It will also talk about travel. And it will ask about testing. Have you tested positive within the last 10 days? So we will be using a screening tool that will help us, and we will be asking people to do it daily. The reason for the daily is really whether you are on campus that day or you're home that day, the first day that you do have symptoms or the first day that you do have your result and it's positive, that's the day that we would like the community, the UB community, to have a sense of what the experience is on the campus. So how many positives do we have? How many people on the campus, are having symptoms at this time? How many people need our support? And so that will clearly give us data in terms of the screening that happens. I don't know if others want to jump in, but I think that the screening tool has the capability of giving us some great aggregate data that really gives us a sense of what the community is experiencing.
Great, thank you. And Mark Coulter, I assume from the employee perspective or point of view, they'll be required to participate in this daily screening as well.
They
Can you
will.
talk a little bit about that process for employees? I assume it's similar.
It is, John. We'll use the exact same tool as part of the community. And while it's being prepared, people are already doing that per New York State guidelines. People are attesting every day to these questions that Sue mentioned, including one of the symptoms being temperature. And we're asking people to do that every day. If, the bottom line is if somebody you don't feel well, don't come to campus. And if you believe perhaps that you have some symptoms, what we're recommending people, don't self-diagnose, call your medical professional, get some advice on what to do next and where to go and what to do. And then in the instances we've had where people have gone down the road of testing, we're in direct contact with the individual, with the supervisor, with the area, and even eventually when someone has tested positive, talking with the Western New York contact tracers from the Department of Health. So the big thing is to really, if you feel those symptoms, is stay home, contact your medical professional, reach out to your supervisor in human resources, and we'll help learn what to do next as a result of anything they may recommend that you do.
And so, Sue Snyder, if a student does need a test, what is that process?
Sure. The screening tool should, at the end of your screening tool, it will give you guidance. This is sort of an enhancement we're able to do with this chatbot feature. So it will give students specific instructions on how to quarantine, how to access testing, who to call on campus for either academic support, emotional support. It will also give them information about housing. So if they are an on-campus housing student, it will give them directions on who to contact, and then that process will take place in terms of whether quarantine is necessary. But the testing feature is really directions at this time as to how to access testing.
Okay, thank you. Yeah, we'll get into the quarantine question in a few minutes. Dr. Wachowski-Wendy, within the School of Public Health, what has been the reaction to these health guidelines and the prospect of reducing risk for your students and faculty and staff? What approach are you taking? It might be interesting to hear a perspective from a dean and the approach they're taking within the school.
Sure. So the guidelines have been out a little less than 2 weeks. I think the reaction from the people that are at our school has been that they're helpful. I think what we're doing today is enhancing this with more discussion that helps people to understand how these guidelines were actually determined. I'll reiterate what Dean Kane indicated, that a large number of those on the video today spent a lot of time debating the guidelines and what to do. In our school, we, over the past about month and a half, have been gradually trying to bring people back on campus. For those that have been away for a while, it seems foreign, and I think getting back gradually and slowly to see the comfort level in our school. We've had very little issues once people are back on campus. They're in their offices, they're following the guidelines. I think it'll take time for everyone to be on campus, and then that's why for our school, we've been slowly bringing staff back to campus. Many of our faculty, in fact, some of our clinical disciplines and students have been here during the summer because they're required to do summer classes that are in person. And we've been able to manage it very well. So growing the capacity on campus over the next few weeks with our faculty and staff, and then bringing our students on campus, I don't anticipate to be a big problem. I think the pledge reiterating the safety measures, the fact that we are in all of our areas trying to reduce density on campus. So in our school, we have about 40% of the entire faculty staff coming on any day, so we can help to reduce density. I know our classrooms and classes have gone a lot of distancing, so we will, again, in that manner, be able to reduce the volume of people on campus. And then those measures, we can't say enough, the masking, the social distancing, regular hand washing, and following this new daily procedure to look at your own symptoms deliberately, report them, don't come to campus if you're feeling ill. I think these all will make us much more comfortable that we're in this together. I consider UB a close community, and I think we'll be fine.
Thank you, Jean. Mark Allnut, within athletics, you've had student athletes on campus for several weeks now. You're following, I think, NCAA guidelines on testing to keep the student athletes safe and also keep the campus safe. Can you talk a little bit about that, please?
Yeah, sure, John. First of all, I'd like to thank the work done by Dr. Kane and their group. Obviously, we're following the guidance of our medical experts, health officials, and being able to share ideas, as we move forward. In particular, as you mentioned, John, obviously there's NCAA guidelines that follow suit with the CDC guidelines in terms of student athletes and the testing that is required for them based on the fact that they're doing some activity that might require a little higher contact than other students. How we've approached this is, again, it's going to sound like a repeat of what everyone else said. Is prior to even coming to campus is extensive education for our students and also their parents when they get here, and also understanding the guidelines that are in place, which again starts with the masking aspect of this. There is also the social distancing that is stressed when in our facilities. Prior to even getting to our facilities, there is the daily screening that is also includes the temperature checks. So we have an opportunity to be able to, catch if there is some symptoms that might happen. And then furthermore, as we go through this, even the activity is one that is spaced. Social distancing is very important. How we even conduct certain aspects of our practice or workouts is not like what we've done before. So being consistent with that, we also, from a testing standpoint, we've done a baseline test for our student athletes, as I mentioned before, because the activity that they're doing is different from others on campus, and also the guidelines that are followed by the NCAA. And then also, we've taken the next step to be able to have regular testing, to be able to ensure that, if we catch, someone that might be asymptomatic or whatever the case is, again, following suit for those guidelines. So, for us, it's very important that we monitor, that we monitor, their activity daily. We also make sure that the density is where it should be. And then last but not least, the contact that's going to be involved with interaction, not just with our students, but also with our support staff and also our coaches. Those interactions are also limited, based on the distancing and the masking aspect of this. So, and then when we do have that student athlete or a staff member that does test positive, again, following the guidelines that are in place, they're placed in quarantine. in a particular residence that we've have secured, and then also through contact tracing to be able to identify particular exposures that a person might have had with that person. We also do the precautionary quarantine of those folks as well for 14 days.
Yeah, Mark, thank you. And I assume that's the same quarantine process that we do for any student to test positive. Sue Snyder, can you talk a little bit about that process? What happens when a residential student tests positive on campus and then a non-residential student? What happens with each case?
Sure. So if a student who is living on campus with us has symptoms or has tested positive, Campus Living will be working with that student to move them into an isolated housing situation. So there is designated housing for quarantine. If they have roommates, the roommate will be put in quarantine as well. If testing has not yet been done, we will try to arrange for that. I think one of the things that Dr. Russo mentioned earlier is that turnaround times for testing are extended right now. And so sometimes the testing, although we would like it, by the time we get the result, it's not as helpful. And so testing may or may not occur for those students in isolation and quarantine. I would say for our off-campus students, we would be, if health services were involved, we would be asking them about their shelter in terms of their housing and if they're able to fulfill their quarantine responsibilities in a safe place. We would also be recommending testing if possible, and then we would support them during the quarantine. Erie County would have definitely a larger role in terms of supporting off-campus students, but we don't yet have all of the details of what they would be able to extend to our off-campus students. We anticipate off-campus students would most likely stay in their residence for the length of the quarantine.
Okay, and then Mark Coldren, an employee tests positive. How's the university notified, and what's the process from there?
First thing is that when anybody has been recommended to go for testing with their medical professional or from a contact tracer, we've always asked them to reach out to us directly in Human Resources and to their supervisor, and then we wait for the results. And in the interim period, that person is then asked to quarantine and stay away, isolate while they await the results. When the results have come in, we follow the directions both from the medical professional, which could say it's negative, they're cleared to come back, but that could have been, as Tom's mentioned many times, the length of time. Sometimes we've waited up to a week. If they advise us, we can help them with their time, because that's what people are concerned with. Do I take sick time or accruals? Once you identify it with us, we can help you manage the time process and use all of the things available by New York State for our employees. And then if they are tested positive, we had recent contact directly with the contact tracer from the Erie County Department of Health. We talked about who they were with, what day did they feel the symptoms, the people they were in contact with. And what I can tell you is in that particular interaction, everything worked well. Everyone understood what they were asked to do. And I think it starts with, I don't feel well, I'm calling my medical professional. And if they recommend a test, call us and call their supervisor.
Thanks. And I can say from a communications standpoint, we're getting a lot of questions about how will the campus be informed when there are positive cases on campus. That's where the university's COVID-19 preparation website, response preparation website will come in. We will be posting notices about individuals, protecting their identity, but when individuals do test positive, we will be posting that on that website, as we did last semester. And I think the process also will continue to be that people on campus who may have had contact with a person who is believed to be positive, those people will be contacted directly by the university or a school or a department. We won't be sending out mass emails to the entire university. We'll be doing more of a targeted approach where we're contacting the people most likely to have come in contact with the individual who may be positive. But that leads to the next question on the contact tracing. I assume we have some collaboration with the Erie County Department of Health, Sue Snyder and Dr. Kane, when it comes to performing contact tracing and following up on people who may have had close contact with someone who's tested positive.
Yeah, so let me begin, and then if Sue wants to chime in, that's fine. So Gail has been a part of our committee, and in her role as Commissioner of Health for Western New York, and as I said earlier, in my role on the Western New York Reopening Control Room, and with direct conversations with the lieutenant governor and indirect with the governor, the state of New York does want to enforce that the actual contact tracing occur under the umbrella of the regional departments of health. These people are trained on what types of questions need to be asked, and they want these individuals to do about 20 hours a week in contacting people, so that professionals, if you will, or experts are the ones that are really getting into contact with people. The partnership that we have and are continue to establish with Dr. Burstein is what are things that the university can do to help either more rapidly or more robustly be able to identify people who may have come into close enough for a long enough duration of time to worry that they could have had the virus transmitted. The standard way that the Department of Health does is a human being calls the infected person up and asks those questions about who have you come into close contact with, and some of those answers then obviously depend on the individual's memory. We are looking at several different adjunct ways to use electronics, one of which is simply Wi-Fi. So on our cell phones, if we have Wi-Fi turned on, we set off a signal every time we pass one of the university's Wi-Fi antenna, if you will. And if I walk past one, it's noted that Michael Caine went past this one and how long I was in that area. So one of the things that we most likely will implement is the ability that once a person has been identified as being positive, as an adjunct to help the Department of Health identify who I may have come into contact with, then we can use me and look at who else on any of the 3 campuses came in close contact with me, namely around 6 feet or less, and for how long that person was in contact with me. So we can set this to be an hour, we can set it to be minutes. Typically around the country, being in close contact with someone for 10 to 15 minutes seems to be the threshold. So we can go and look at everybody who's been on campus and see whether or not who and for how long people have been in close contact with me. We can identify those people by their unique iPhone and Wi-Fi signature, if you will, and then get in contact with those people and also give those to Dr. Burstein for the Department of Health's contact tracing people to contact. So, and there's a couple other ways that we are looking at seeing whether adjunct things using our cell phones can identify people who are off campus primarily, And we're looking at these almost every day. But we will be able to provide adjunct ways to help the Department of Health identify who has come into worrisome close contact with someone who is infected.
Thank you. Sue, anything to add?
No, I think that was a nice summary of where we are. And I think, as we move forward, the partnership of what Erie County can do and what they need assistance with will become clearer.
Okay, thank you. Let's get back to what it's going to look like on campus this fall. We're getting a lot of questions about cleaning and density on campus. So let's talk a little bit about what's it going to look like. Provost Weber and Graham, I know you've been talking a lot about density, reducing the density on campus, reducing the density in classroom spaces. It's a big part of our reopening plan and a big part of our health guidelines. Scott, can you talk a little bit about that?
Sure can. We've gone through a fairly robust process of reconfiguring the academic schedule, and I'm going to let Graham speak in more detail about that. Clearly, we have reduced the number of in-person instructional opportunities on campus, and actually we've begun to map, and I'm going to let Graham speak specifically to that. And what we're also doing is doing density mapping in basically every academic building on an hourly by hour basis that we can then provide, I think, to the campus that will help people understand what that density looks like. I think the idea that the campus is going to feel similar to its fall 19 is probably obviously not correct. I think that there will be a significant reduction in density. I think that along with, as you've heard many times today, the face mask covering and all hand washing, social distancing, really important. And part of that reduced density, of course, is to provide the social distancing. So Graham, I'm gonna let you talk a little bit about some of the details there because you really have been on point for that.
Okay, thanks, Scott. So from the perspective of just the physical campus, when we were planning for academic continuity, one of the most important things was obviously to follow the health guidelines. So we did an analysis of all classrooms to make sure that we would have classrooms online that could accommodate distancing, and took a number of classrooms offline to be able to lower density in buildings themselves. So inside individual classrooms, there will generally be no more than 25% of seating capacity in comparison to normal seating capacity. So inside classrooms, density is significantly reduced. In terms of between classes, one of the big questions is how do you reduce density when classes, between classes, when students are going from one class to another. We've put 20 minutes. We've increased the time between classes to 20 minutes, and that's partly to decrease density in hallways, and also to reduce density as students enter and exit classrooms. And I would say that one of the most important things that faculty can do is be very mindful of ending classes on time so that students can leave and there won't be a bottleneck of students trying to get into a classroom and exit a classroom at the same time. The other thing that would be very important to do is to map out exit strategies for your classroom so that when you end a class, maybe you dismiss a class by row or by segment so that everybody's not leaving at the same time. That's a very good way to help reduce density. Given those measures, and also given the percentage of classrooms that will be taught in person, I'll say more about that in a second, what we're really expecting is that we'll have between 10 to 15 plus, and those are rough numbers, but 10 to 15 plus numbers of amount of students who will be on class for taking courses. In terms of the classroom schedule, right now, 43% of classrooms or classes will be delivered in person, and that's all in person or hybrid in person or high flex in person. So the overarching sort of all encompassing in person, and 57% of classrooms are going to be delivered entirely remotely. So if you put all that together, I think what you're going to see is that there will be significantly fewer number of students on campus at any given time.
Okay, and now let's shift a little bit. We're getting a lot of questions about cleaning and disinfecting in the classrooms. and other spaces on campus, including office spaces. Joe, Rab, can you help inform us on those topics, please?
Yeah. And when we're talking about cleaning, the first thing I want to do is to extend some accolades to my fellow university facilities employees who've been just doing an outstanding job during the summer months of keeping the campus clean. Our custodians and many facilities trades personnel have been deemed essential right from the beginning and have been here throughout the summer working on the campus and making sure that it's as safe as possible for all the occupants of the campus. We've had other essential personnel, essential laboratory work, and some academic programs over the summer. And we've been making sure that we do everything we can to keep those in safe and good condition. So when it comes to cleaning on campus, one thing to understand is that our custodial staff will actually have 3 different shifts of presence on campus. And so that'll be 24-hour round-the-clock presence on campus for our custodial employees. They will be doing a lot of regular cleaning, but also some deep cleaning. And the types of disinfectants they will be using are the disinfectants that have been shown to be effective against COVID, and they will be using them in a way that will properly disinfect the surfaces. Most of that deep cleaning will be happening during the evening shifts, so many people won't see it, but it'll be happening. And then during the daytime shifts, they will be going around and doing some extra amount of cleaning on high-risk spaces. When we talk about high-risk spaces, we're talking about things like restrooms and any frequently touched surfaces throughout the public spaces. So things like doorknobs, hand railings, all sorts of things that people would touch all day long. They will be cleaning and disinfecting those frequently to ensure that they remain in a good condition. Another thing that I wanted to mention here was the fact that we distributed some startup kits out to the various offices on campus. And the way that we did that was we worked with university procurement to get some supplies as far as disinfectant supplies, bottles of hand sanitizer, and also Clorox wipes. And believe it or not, you've probably seen all the news reports on Clorox wipes today, but we were able to actually obtain a limited supply of Clorox wipes for the campus. So altogether, in terms of the distribution of those startup materials, we distributed about 2,000 containers of Clorox wipes to the campus, about 3,000 of the hand sanitizers, and about 550 of spray bottles of disinfectants, along with rags or paper towels to apply those disinfectants. So we use the FPMOs, the facilities management officers, to basically distribute those out to the groups on campuses. We're asking that offices use these supplies judiciously, but in general that they use them to, again, clean frequently touched surfaces. If they have shared equipment, to clean those things in between sharing. When you're talking about cleaning, another thing to mention is just the hand washing again. It's so important. I think throughout the course of our day, we will touch things that maybe have been cleaned but may not have been cleaned recently. And the thing that we need to do is be aware of our hands, don't touch your face, and wash your hands frequently. And the best way to do that is with soap and water. We will make sure that there's a copious supply of that in every restroom on campus, and that people have that available to them as an option. There will also be extra hand sanitizer around campus in hallways, near many building entrances, near many drinking fountains and restrooms. We will have hand sanitizer on campus. So I think that you'll find the campus clean and that we have a lot of things available to help you in that process. One other thing that I wanted to mention here too is that I know a lot of people have been very concerned about touching surfaces and things, but in a recent clarification, the CDC clarified that although touch surfaces are important and we want to be sure to have good hand hygiene, it's not thought to be the major way at which people are, at which COVID is transmitted between person to person. It's still thought that respiratory droplets are the major way. And again, along with mask wearing and our other precautions, I think we can keep people in a good state as far as the campus goes.
Thanks very much, Joe. If you don't mind, we're getting a few questions about UB's HVAC system. As you know, there's been a lot of items in the news, coverage in the news about whether the coronavirus is spread through droplets in the air, and you know, the the ability of HVAC systems in buildings to screen that and filter that material. What I know you've taken a look at UB's HVAC systems. What approach are we taking?
Yeah. So HVAC systems is another area where we've spent a lot of time on, and we've tried to be as prepared as possible for the campus. The CDC has guidelines on HVAC systems, and when they talk about return to work and return to school, some of the things that they highlight in particular are mold in the HVAC system and potential for Legionella. And our own facilities department has been going out and doing all the necessary things to make sure that those two items are well handled and that we don't have any of that in the system. We're constantly inspecting and looking for mold. And in terms of Legionella, there's state required testing, and we're making sure that we fulfill those requirements to test for Legionella. As you mentioned, the other thing that is of concern with HVAC systems is whether or not this virus can be distributed via very small, less than 5 micron aerosols through the HVAC system. And there's a lot of scientific debate on that. The scientific debate certainly isn't resolved. Some of the main agencies here, like CDC and the World Health Organization, have issued clarifications that there is a possibility that these aerosols exist, but be aware that the major way that COVID is still thought to be transmitted is through larger respiratory particulates. And so a couple of things, overall as a campus, again, our big measures and the universal mask wearing is a main thing here. If we all wear universal masks, then we significantly reduce the risk that much more of something being transmitted through the HVAC system. The density reductions that we're doing as a campus will also help reduce that risk. So we want to do as many measures that we can within our control to reduce those risks. The other thing that we're doing as a facilities department is the CDC has issued a list of considerations for us to look at in terms of the operating parameters of the heating, ventilating, and air conditioning systems. And so we are sending university facilities personnel out to do an inventory, to continuously update that inventory, and to look at our systems and the operating parameters and see what can be done. It's not always possible to make adjustments because systems are designed a certain way. It's not always possible, and sometimes it would very much affect the airflow, the comfort, the temperature and humidity within a space if changes were made. But we're seeing what we can do and trying to make as many improvements as possible. And that includes, increasing run times and taking other measures to try and maximize the ventilation, again, to try and reduce the risk as much as possible.
Thank you, Joe, for that thorough answer. Dr. Russo, you've looked at this issue as well. Do you have anything to add?
No, I think that the transmission of this virus and infecting people through HVAC systems is really a theoretical consideration at this point. And as Joe mentioned, I think that the major mode of spread is quite clear. It's through close personal interactions, and those public health measures that we've talked significantly about today will really protect us from that.
Getting a lot of questions. A few of them relate to what metric the university will use in monitoring the spread of the virus in Western New York, and how that might affect decision-making as to whether to move instruction to all remote instruction again, as we did in March last spring. Scott Weber, can you talk a little bit about what those metrics might be? And Dean Kane, what are we monitoring? What might lead to a transition back from mixed or in-person instruction to all remote instruction?
I can take a first stab, and then if Scott wants to add anything to it. So I think the two principles are, you want to monitor things that tell what is the infection rate in your community. And the second is, regardless of what that infection rate is, are you anywhere near overwhelming your healthcare system to take care of the people who have the disease, whether it's 10 people or whether it's 10,000 people? So on the latter side, as far as what metrics do we have to follow on the the broader community and the hospitals, then again, with my position on the Western New York Reopening Board, we get these data every day from Erie County as well as all of the counties that make up Western New York. And these data include how many tests were done for COVID and what is the positive rate for the number of tests that were done that day. The second one is of people who test positive, how many of those are there per 100,000 people? These were two metrics that Tom mentioned in his response. The third is, what is the severity of the disease that people are having in the community? Do these require hospitalization? Do they require general hospitalization? Do they require people to be in an intensive care unit? And if they're in an intensive care unit, do they require a life support, if you will, on a ventilator? So every day in every hospital that's in the Western New York counties, those data are accumulated and provided to the state and the local Erie County health organization. And so there are metrics, and these are ones that Governor Cuomo is using to determine whether a state outside of New York has a high enough infection rate that we would worry that random people coming into the state would bring the disease. And these are typically ones that if you are at the percentage of tests that are positive rises above 5%, and if the number of people who have it per 100,000 gets up over 9 people on a daily basis. On a UB point of view, we also want to keep track of what's happening within our university community. And through the current web-based attestation that Mark spoke about, through the chatbot technology, which will be coming shortly, we'll be able to keep track of how many people said I have no symptoms and how many people said I do have symptoms as one metric. So we can also keep track, because we do get those data if anyone in the community turns positive in our UB community, how many people in any one day in our UB community actually test positive. And I think other metrics that we would want to keep track of is, do we have enough faculty to teach the online seated courses? I mean, the seated courses that Graham spoke about, and also for those seated courses, we expect a certain number of students to come, and are they actually coming? And if they're not coming, and most of them are staying home, and there's only 2 or 3 students showing up, be able to have the discussion that maybe the best thing would be is to convert that class to a full remote class and not risk 2 or 3 people coming to the campus if most were not. And I think the final piece is, how are we doing on protective personal equipment supplies? And are we at any risk of depleting those to where the moment would come where we wouldn't have enough personal protective equipment for our faculty, student, and staff. And Scott, whether you have anything else that you'd like to add.
Michael, that was a terrific summary. The only thing I would add, and as you know, is if the governor decided that it was in the public health of the New York State for, as we saw in March, that universities would close, that obviously we would follow that direction.
And I think one other one that I neglected to mention was that, as Sue Schneider said, we will have a quarantine isolation building on the campus. And so one of the metrics we would know every day is how many people have been assigned to that quarantine or isolation building and keeping track that it doesn't become overwhelmed and that we then have no place to put people who deserve to be there. So I think we have lots of metrics that look at the health of our community outside of UB and the health of our community within the UB campuses.
Thank you, Michael. Mark Colden, we're still getting a few questions. Is there been any policy change on working remotely or coming to campus? A few employees are still seeking more direction on that. What advice do you have? Share.
There really hasn't been any change, John. I think everything that's been identified is that first, if people are able to effectively work remotely, that's a great outcome, and we should continue it. And for anybody who's represented by a bargaining unit, that has been pushed into the fall to allow people to be able to do so. We've had return to work plans submitted since the beginning of July. We mentioned density of 50% as a target. There are many offices who will actually have maybe no one, and because they've identified effectively how to work remotely. If any individual is having challenge with this, they should really work with their supervisor to identify what's the reason, what are the reasons that potentially they need to be on campus for a particular schedule. And I'm going to say there's a number of different things. One, we're challenging offices to think a lot about, can you do appointment first service models as opposed to walk-ins? We're always very, very cognizant of trying to do walk-ins, and there's some places where that's just the mode that we're going to need to do. But if we do appointment first, it may be best that that appointment takes place virtually as opposed to face-to-face. So we have many, many individuals who are going to be asked to work on some kind of a schedule, and it may be because of the nature of their job. There are some folks that say, why can't I work remotely? I have been since March. Well, that was a whole different element with the governor saying non-essential and essential. And those terms are different today. And so right now it's about the services we need to provide for students. So if anybody has any challenge, work with their supervisor, call us. We'll help walk you through how we can help accommodate if somebody needs something like that, or as opposed to what's the kind of work you're doing. Some positions will need to be ones that have presence. And so we want to make sure we can do that for students.
Great, thank you, Mark. We've received over 150 questions, and it's tough to get through all of them. A lot of the questions are addressed on the university's COVID-19 planning and preparation website. I would encourage everybody to go there. There's an extensive FAQ, searchable FAQ. If you go to the UB's website, there's a yellow banner on top of the homepage. You can click on that, and a lot of your questions will be answered. We will go through the questions we've received and try and add answers to those questions that may not be on the website. So I appreciate your patience. We've been trying to get through as many questions as we can. We do have time for one more question before we turn it back over to Scott Weber for some closing thoughts. And I thought we end hopefully on a more positive note about the situation with the pandemic, and ask Dr. Rousseau what the progress is right now with a vaccine, and what does that look like in the next few months.
So thank you. Before I touch base on the vaccine, I just want to emphasize for everyone what a great job we've been doing here in Western New York and Erie County. We have one of the lowest infection rates in the entire country. And as I've stated many times, we're the ones with our behavior that control the number of infections we're going to have. So I think we're extraordinarily well positioned, almost best positioned in the country to reopen our schools. We just can't get lackadaisical. We need to keep it up. We need to be vigilant and rigorous with continuing to use the public health measures. And for those people out there, that small but significant minority that's been a little bit recalcitrant, please, please, please get on board with us. I'm an optimist. I'll preface this, John, in terms of the vaccine, but I'm very, very hopeful that we'll have data demonstrating perhaps not one, but multiple vaccine candidates that are both safe, and I can't emphasize the safety aspect enough, and efficacious, in terms of decreasing getting infected with the new coronavirus. And what that would translate into is this vaccine hopefully being available in the very early part of 2021. And just to let everyone know how this would work because of the extraordinary times. Ordinarily, the process of vaccine development, which would be much more protracted, the record holder is mumps at 4 years. We've already broken that record with all our phase 1 and 2 trials and trying to compress it to less than a year. Ordinarily, you would have to show safety and efficacy before you would even consider making the vaccine. But vaccine production is ongoing right now for our leading half dozen candidates or so. So that if one or multiple of those candidates show that they're safe and effective, then the vaccine will be available for administration nearly immediately. Now, to get people vaccinated, that's going to take a little bit of time, and that's going to take a couple of months, and hopefully everyone will realize the importance and buy into that. Adults aren't quite as good with vaccines as with children. So I'm encouraged. If everything goes well, I think we're sort of staring at maybe 6 to 8 months, best case scenario, before we get on the other side of this. But I think that's a realistic guesstimate. So we just kind of have to hang in there and carry on what we're doing so well right now here in Western New York for a bit longer. And as schools reopen and as the weather gets a little cooler and we kind of make that shift from mostly outdoor activity to indoor activities, that's going to increase risk a little bit. So we really need to double down on our best behavior.
Great. Thank you so much, Tom. I appreciate it. And wear a mask.
Please.
Scott, some closing thoughts?
Sure. Well, first of all, I'd like to thank, I think it's the record I've seen, we had over 1,300 members of the university community participating in the town hall today. So your participation and questions speak to your dedication and interest in a safe operation of our campus for the fall semester. And I'm so appreciative of your participation and your questions. As John said, if we weren't able to get to a question and it's not been already answered, we will do our very best to do so. Second, I want to thank our panelists for their service and incredibly strong work that has led us to this point. While not everyone may agree with each of the recommendations or guidelines, I'm deeply appreciative of the time and expertise that each panelist and other committees not on the program today have given to the development of this robust set of guidelines and recommendations. In doing so, they've given their very best advice to our campus. And the integration of this advice into the health and safety guidelines really has put us in the best possible position for the launch of the fall semester. And finally, as mentioned several times today, this really does continue to be a fluid situation, and we recognize that recommendations and our direction may change as additional information and or conditions change. So please be assured that we will continue to do and communicate all we can through all available mechanisms to share our path forward. So again, thank you for participating in today's town hall regarding UB's health and safety guidelines. Please wear a mask and good afternoon.